Greetings, everyone, and welcome to the webinar, Protecting High-Risk Youth, Opportunities in Education and the Justice System. My name is Kayla Thompson, and I am technical support for this event. We would like to review a couple of housekeeping notes before we get started. First, all attendees will be muted for the duration of the webinar. However, we absolutely anticipate and hope to hear from you via the chat feature in WebEx. To open the chat, you can click the chat bubble icon on the lower right-hand side of your screen. If you have any technical difficulty during the webinar, please send a chat message to the host and we will be able to assist you. Finally, this webinar is being recorded and the recording will be made available to participants at a later date. That does it for my tech notes. I will now pass it over to Jean O'Connor, who will introduce today's content. Jean?
Great, thank you so much. Welcome to the next event in APP's Social Determinants of Health Thought Leader Series, Protecting High-Risk Youth, Opportunities in Education and the Justice System. My name is Jean O'Connor. I'm a principal here at APT Associates and a lawyer and public health practitioner. I'll be facilitating today's session with our three amazing guest panelists. During today's webinar, we'll hear from former prosecutor and author Daphne Robinson, who will explain how the juvenile justice system continues to adversely impact the health and well-being and economic development of Black children in America, and who will discuss the devastating costs to society. Daphne has more than 20 years of experience as a prosecutor and returned to school mid-career to study public health. Christine Judd is from Roca, Inc., an internationally recognized organization that uses trauma-informed behavior change as an intervention model, and she will discuss how their interventions are disrupting the incarceration pipeline and transforming the lives of young people at the center of urban violence. Chris worked as an educator and a dean of students in a high school and then in law enforcement before becoming the director of Roca's work in Western Massachusetts. And third, we'll have Dr. Terri McFadden. Dr. McFadden is a pediatrician and a faculty member at Emory University who studies early brain development and runs a statewide school-based health center initiative in Georgia. She'll discuss how prevention, education, and justice systems are intertwined and how policies can exacerbate systematic institutional racism and poor outcomes. We're really delighted to have all three of these panelists here with us today. As we know, poverty and systematic racism are major risk factors for entering the juvenile justice system and child welfare systems, which in turn can increase the lifelong risk of poor health and well-being. So in this webinar, we'll discuss the problems and potentials for solutions to break those cycles of poverty and crime and inequity. And again, audience members are invited to place their questions into the chat. We'll get to as many of these questions as possible. But let's first get started with Daphne Robinson. Daphne, so excited that you are here. Really interested to have you tell us about your book, Delinquent, How the American Juvenile Justice System is Failing Black Children. Tell us what drove you to write that book, what you think everyone needs to know about the relationship between the justice system and the well-being of children, especially Black children.
Well, thank you, Jean, and thank you to your organization for inviting me to be here. I wrote the book, Delinquent, How the American Juvenile Justice System is Failing Black Children after, I think, a very difficult time as a prosecutor. It was really the last 4 years that I served as a prosecutor that were the most difficult. It was after having gone to public health school and working in the public health field that I saw that the system that I was working in was not going to change, and that nothing I did, nothing I suggested would encourage people to try a different way. I had a really bad accident, and I hit a brick wall during the course of that accident, and I saw it as a metaphor for where I was professionally. And I just felt like I was hitting a big brick wall and trying to change the system that I was working in. The book is really about, it takes a historical overview of the juvenile justice system and its treatment of Black children, particularly. And I'm asked often, why did you write a book that's centered around Black children? And the reason is that Black children are overrepresented in the juvenile justice system. They are 5 times more likely to be arrested, 3 times more likely to be detained in juvenile justice jails, essentially. And I felt like if we could improve the lives of Black children and improve their standing, then we will improve the lives of all children in the juvenile justice system, because Black children, to me, get the shortest end of the stick there. I appreciate the invitation, Jean, and thank you.
Okay, I'm glad you're okay after that accident, and it gave you the inspiration to write this book. We're gonna, I think, talk much more about some of the things you just raised, but I want to give Chris Judd the opportunity to share her work with us. Chris, you have a really interesting background, going from education to law enforcement, and now working on disrupting the violence pipeline with Roca. Can you tell us a little bit about how you ended up working with the organization and what kind of successes you've seen for youth through your work at Roca?
Yes, well, first of all, thank you, Jean. Thank you for Apt Associates, and thank you, Daphne. Also appreciate being here. So I feel compelled to say that my law enforcement stint was a very small one, but most of my work was in education and working with young people. And I've been working with young people since I was a young person. So I came upon Roca because I worked for one of the best, Hampden County Sheriff's Department is one of the best. It's leading in the nation around reentry work, because the sheriff, who served for over 40 years, was a social worker by trade, and so he wasn't a law enforcement person. And he is one who is a mentor to me to this day, and there was an opportunity to work with Roca while I was working for the Sheriff's Department, and I quickly jumped to it. And because it's important to me to make sure that we, really wrap our arms around our young people in this country, but more importantly, the marginalized youth. So Roca really works with young adults and system partners at the center of urban violence. So our young people are 16 to 24 years old who've experienced extensive trauma, and they're the primary victims or drivers of urban violence. Roca uses the term high risk, and it's important to know what differentiates a young person, an everyday young person versus a Roca's high risk. They're involved in the criminal justice system. They really have a low literacy, typically no high school degree or GED. They have no formal or sustained employment history, involved with guns, gangs, and drugs. They've failed or dropped out of programs, schools, jobs. So if a young person can, walk in and make an appointment and they show up, that's not a Roca young person. We really do door knocks. We're out there in the streets. We have an amazing team who have, been in that lifestyle and changed, and really are great examples for our young people. And a lot of our young people, especially our moms, we have young parents. And so why do we do this? Well, we want to reduce the incarceration rate. We want to, sustain employment. We want to improve parenting. But we can't just do that by just saying, hey, we're going to do that. Years ago, Roca's been around for 34 years. We're coming up on 35. And we really focused in on understanding the change through the stages of change, which is pre-contemplation, contemplation, planning, action, sustaining, and we build in relapse. And that's really what Molly Baldwin, our CEO and founder, kind of hung our hat on. And that was what we were. And then 8 years ago, we decided we have to do something different. These young people are so traumatized. What are we going to do? So we partnered with Mass General Hospital, and we really worked on and we learned. And that's what I love about Roca, is we're a learning organization, which really falls in line with my education background, is that we learned that brain development and trauma really affects brain development. And so we started studying it, and we used who is our, our young people. We started studying them based on their, emotional literacy. So we do a whole change assessment with them, and we follow up and same questions. And we developed our own cognitive behavior theory. So we call it theory because, we're just very much lay people. We don't come up with the LSIW and things like that. But the idea is that when I'm going to try to break it down very quickly because, and not as heady. I'll leave that for the good Dr. Terri. But we have three parts of our brain. We have the bottom brain, the middle brain, and the upper brain. The bottom brain is our fight, flight, and freeze. It's our basic, it's our survival brain. Our middle brain is our limbic system. It's our processing center. And then the frontal cortex, which is actually the newest part of our brain as we evolve as human beings, and that is where we have our thinking system. And if you can think about a young person that when the best I can describe it is, if you're driving down the road and you get cut off, what's the first thing you're going to do? Most people might flip them off. Most people might like F you, all these things, right? Well, our young people, when something like that happens, or let's say you're in a traumatic accident, right? Think about what you're doing. You're probably white knuckling the steering wheel. Your legs are probably going numb. You're getting hypervigilant, and you're not really thinking. Your frontal cortex, your thinking brain shuts down, and that's what happens to our young people. They go into overdrive when they're trauma, when they get struck by trauma. So you think about when police brutality, and you think about shootings, and you think about all the things they witnessed at 3, 5, whatever it is, years old, and the stories, the stories that we can tell are crazy. We teach our young people to process all of that, and it's a long-term process, so it takes a while, but while they're doing it, it is pretty amazing to watch. And I don't want to take up all the time because I want to leave a lot of, I can bring this up later, but I'm going to give you a quick example of success of our cognitive behavior theory. We had a young man at a local park who found a rival gang member. He saw a rival gang member. He was there with his family, and he's called his boy and said, "Hey, bring my bag." Well, inside his bag was a gun, his a mask, and gloves. And it took the young man's friend a little bit while to get there. And while he was there, he's watching this gang member, look at him, give a little like, "What up? I see you." And he noticed his family was there. His son was there. This 20 minutes that it took to get that gun there was that process. Normally we say 30 seconds, but that was a process where all the times that we were able to say, what do you value? You value being a dad. What do you value in terms of yourself? You want to go to jail. Do you, let's flex your thinking and say, did he really say, I'm going to kill you? Or did he just say, "Hey, I see you, but we're here with my family"? When the gun got there, he actually told the young man, "No, take it back." And then the first thing he did was he called his youth worker and said, "Yo, this CBT stuff works." It was a little more colorful conversation than that, but that was in the preliminary stages. So I'm just excited to be here. There's so much to talk about, and I give you the floor back. Thank you for having me.
That's awesome. Thank you so much for sharing that, Chris. That's a great example and a really, really interesting introduction. I think can't wait to hear more about that. So last but not least, I want to give Terri just an opportunity to share the floor here before we dive into discussion among the whole group. So Terri, your work is very upstream. I mean, you're pediatrician, babies and young children, and you work extensively on prevention and on things like school-based health centers. Tell us a little bit about something that you've described to me as the school to prison pipeline and your work to try to disrupt that and its relationship to children's health. Tell us how you think what can we all be doing to better prevent youth involvement in the justice system?
Sure. Thank you so much for having me, Jean. And I feel so honored to be with this esteemed group of panelists. Chris has already just given you all a basic course in neuroscience. And I would just say that, one of the things that we hope to do is to try to prevent, I'm so glad that Chris and her organization exists to try to retrieve those high-risk children who have experienced so much trauma and now find themselves in a place where many have given up on them. So thank goodness you exist. But in disrupting the school to prison pipeline, the hope is that there would be fewer of those children. So let me just step back and say, when you probably ask, well, why a pediatrician? And I would say that first, as pediatricians, we're charged with trying to work with families to make sure that children reach their full and optimal potential. And academic success is both an indicator of how well a child is doing, but it's also a predictor of their long-term capabilities and their long-term trajectory, because if they don't do well in school, then their possibilities are somewhat limited. And I always like to remind everybody that the WHO says that, health is not just the absence of illness. It really is about reaching your full physical, mental, and social well-being. And so that's what we're trying to accomplish. And so the school to prison pipeline is a metaphor, if you will, for the sort of policies, the disciplinary policies that many schools have in place that really kind of derail children who are trying to reach that academic pinnacle that we all want them to do. And these are exclusionary and harsh disciplinary procedures that take children out of school, in a way that, they never really recover that academic time. So it takes them out of school, it perhaps propels them into the juvenile justice system, and it sets the stage for them to enter the full-blown criminal justice system as they continue. And so, there are a few policies, and I know we'll talk about this in a little bit, but let me just set the stage by saying there are a few policies that really fuel the school to prison pipeline, and they include this reliance on zero tolerance, which sort of came out of the 70s and the, get tough on drugs, but, you've heard about 3 strikes, all those sort of rules that have trickled down into the school system, so that children who have that lack of maturation of that prefrontal cortex that Chris was talking about are now treated as if they're fully grown adults who haven't experienced some of the things that they've experienced that have shaped their health and their behaviors. It's also about this over-policing of schools. And I know in the wake of Uvalde and all the violence we've seen, school safety is a real issue. It's a real concern. But the problem is, having a big police force within a school has not really been shown to decrease those mass shootings in schools, but it has been shown to actually, increase the likelihood that a child gets arrested in a school. And then I guess the other thing to think about is the disparities that arise. This is an issue for all children, but it's especially an issue for Black and Latinx children. Just to throw, and for children with disabilities, just to throw out a few statistics, 2 million children are in a school, nationwide, are in a school where they have police officers but no guidance counselors. 6 million children are in schools nationwide with police but no psychologists. 10 million children attend schools with police but no social workers. So we really have to reorient the way we're thinking about our children and the sort of mental and behavioral and physical health challenges that can lead to behaviors that are perceived as threats. And so as a pediatrician, we know that school-based health centers have been found to be very effective in, improving access for children, because you eliminate many of the barriers that children face when it comes to access. Plus, when school-based health centers are integrated into that whole school fabric, then, they become part of this whole trauma-informed approach that Chris was talking about, and the restorative justice approach, where you're changing the climate in schools, where we're all working together to understand not just the, why are you acting like this, but the what happened to you, which is how trauma-informed approaches change the way we work with children and families. So thank you for having me today.
Great. Yeah, thank you so much, Terri. So this is just such an amazing panel, such a rich set of experiences and backgrounds. We're going to have a discussion across kind of all 3 panelists and for a few minutes here. And again, want to invite the audience to submit questions, and we'll get to those as we're able to. But Terri, you brought this up, and so I want to just kind of start us out with something that I know is a hard question, a hard topic. I think it's hard for everybody, particularly right now. But as you know, as we look at the national news, we hear so many stories about gun violence involving children and young people, both as victims and as perpetrators. And you know, I want to talk about what you all think we could be doing differently in our schools and in our communities to prevent this type of violence. And I know that from your backgrounds, things like early education and health centers and restorative justice and crisis intervention are probably going to come up in this conversation. And that's really want to get at kind of what could be, what we could all be doing more of that would help to prevent this kind of a situation in the future. So maybe we'll just start there. And I don't know if there's anybody who wants to dive in, go first.
I don't mind jumping in, but I feel like it's important to also, you know, it's very interesting that the hot topic in gun violence is now ghost guns. And if you think about ghost guns are a hot topic for the state legislative, and all of a sudden it's a big issue because, you know, the gun manufacturers are not getting paid with ghost guns. They're being made on digital printers, right? So I just want to put that out there as a future topic. But I think what's really important here is having your local leadership. There's a lot of great communities here that within the United States that the local leadership are not acknowledging how systemic racism works and what it is. My local community itself, understanding that we have a lot of social service entities that are working in silos. So you need a community leader that will come in, and I know there's a lot of social service entities that are trying to do it ourselves, but wouldn't it be great if we had a mayor or state representatives or whatever saying, you know what, we're going to actually bring all the figureheads and together and see where the gap of services are. The other thing is, it's not just about that. I think about what you know, Terri had talked about in terms of pediatrician. As an educator, a lot of times in this dean of students would come down and teachers would say, well, they're unruly. Well, I worked for a parochial school, and who was unruly but the black and brown children? And why were they unruly? Because single parents, mother worked overnight, the kid didn't have any food. So what I would do is feed him or her, and give them food or take them for a walk and just discuss what's going on, and then able to almost say, okay, next in the morning, I want you to come in and, you know, 15 minutes instead of hanging out in the hallway, come to me and we'll make sure you have your meal that you need to get, and be successful in that way. So I think a part of this is understanding where the young person is coming from and what is going on at the house, and having, because there are so many services out there that social service entities need to do those door knocks. A lot of social services give them appointment cards and expect them to come in. They're not going to, because maybe they're embarrassed or maybe they can't get there. There's so many different things, but I defer.
Daphne, I think you're on mute.
Okay, I have two mutes over here. Sorry. Jean, I think as it relates to gun violence, it's difficult to find the answer, and it's certainly going to take a community-wide approach. I'll give, I guess, an example in my own experience that, as you mentioned, I was a prosecutor for 25 years, and it was probably about 10 or 15 years ago that I started to notice that just about every young male, and sadly there was an overrepresentation of black males, but every young male that came into court had access to or possession of a weapon. And it just became a question about where are these guns coming from? Why are so many of the young people in the system? And as I came to the end of my career, it was just common to see a young person who was 14, 15, 16 years old, male particularly, who was in possession of a weapon, and serious weapons at that. More often than not, those weapons came from burglaries. In my in my attempt to do data in the juvenile justice system, which is a whole other story, the lack of data that's there for prosecutors and judges and probation officers. But in my attempts to do data, one of the crimes that was most prevalent among young males, black and white, 15 to 16 years old in the jurisdictions that I worked in was burglary. And most of the time they were breaking in, I mean, certainly money, and breaking in to find guns. Guns in cars, guns in homes, guns in businesses, and very often, you know, that's where they got them from. And then when, as a prosecutor, sadly, I didn't get the opportunity to sit down and have the kinds of conversations that I wanted to with children who were accused. But what I learned through my work was that most young people will tell you they don't feel safe. And that's why they have a gun, because I feel like I need to have a gun in my community because somebody might jump me, somebody might rob me. And so we need to have a community-wide discussion about why children feel unsafe in their communities. My last 4 years of practice were in Shreveport, Louisiana. It's Caddo Parish in Louisiana. And much like other cities across the country, it has seen a rise in violent crime, gun violence. I have one of the programs that I think would be very beneficial for Shreveport as well as other communities is the Cure Violence Program. It's a program where we treat gun violence as if it is a disease, because it is, because we see that once there's one, it's a contagion. Once there's one shooting, there's another shooting, and then there's another shooting, much like infection. And so if we could get the model that Cure Violence uses to go into communities with trusted individuals who are called interrupters, and they're known to the young people in the community. They're trusted because maybe they've done some time. Maybe they've been in trouble themselves and they've seen the error of their ways. So those people become the trusted individuals, and then we can start getting to what is at the core of why young people feel so unsafe in their communities and why so much gun violence is going on.
Okay, it looks like Terri, you might be jumping in here. I think you're on mute as well. Still on mute. We'll hopefully see if we can get Terri off mute. And while she's doing that, Daphne, it's still on mute. Uh-oh, I think that's not intentional, so we'll give her just a second.
I can jump in around the violence interrupter and pure violence. That's what Roca does, Daphne, which is great. We have a whole staff of violence interrupter. We call them youth workers. They have caseloads of 25. We have outreach workers. We're partnering with the local hospital to do a violence intervention program. So every gunshot that doesn't matter age, we're down there, and we're partnering with other organizations to make sure the wraparound services. But you're right. It's, every young person we talk to, why are you carrying a gun? Because I feel unsafe. I'm going to get them before they get me. And it's not intention. This is the other thing. Thomas App wrote a book, and it's oh my gosh, I just totally blanked on it, the lead book. But in part of it, he talked about the fact that, shooters are a small percentage of the, let's say 100 young people in a community, only 1 or 2% of them are actual shooters. The other ones are individuals who are just in the streets because that's their family. They don't really have that's what they consider, the street. They feel comfortable with that. And again, they have quite a few of them. Most of our young people, their fathers are incarcerated, previously incarcerated, or not around, and it's their moms are working hard, or or unfortunately substance abuse. But with that, it's a small percentage that are actual shooters in communities that are doing the discourse, but a high percentage have access to guns and a high percentage carry guns, and that's the issue. Terri, back?
And
No, not yet. I think we're trying to get Terri's technical challenges solved. While we're doing that, Chris, that's a really interesting perspective. And this piece around sort of the idea that there's a, almost like a contagion effect, and that this can be interrupted is a really kind of interesting idea. I mean, one thing that I'm wondering about too is particularly in the school setting, you all have mentioned the sort of cure violence in the community setting, but what about in schools? What are some things that could be done, Daphne and Chris, to kind of reduce that level of fear and conflict? And specifically, I'm thinking about restorative justice. I'm wondering if you have any comments about that.
Jean, can you hear me now? I'm on my phone.
Yay!
Okay. Yeah, boy, this tech life we're living, it requires all of your neurons to connect, right? I just wanted to sort of jump in. I'll address your question, but I wanted to say a few things around what Chris and Daphne were just saying. It's important to recognize that we have all of these historical inequities. Let's see, now my
Keep going.
Oh my goodness. We have all of these historical inequities, that stem from, if you go as far back as redline communities, which I guess everybody understands that redlining happened when the U.S. government in its infinite wisdom wanted to stimulate the economy after the Great Depression. And what they did was to support communities to provide funding for people to buy homes. But all of the Black communities were excluded. And if you follow these patterns of violence, poverty, unemployment, they still fall in those previously redlined communities. And so it's important that we understand the roots of these problems didn't just appear because we have Black and brown people in communities. They are rooted in these systemic structural inequities that have been going on forever. And then the other thing I wanted to mention is that the youth that get the harshest punishment, to your point about what happens in schools, are usually the ones who have experienced the most trauma. And earlier on, Chris talked a little bit about the impact of trauma on the brain. It's almost grandma science, I call it, because it's the things we've always known, but now science has caught up with it. And what we find is that the actual architecture of the brain is shaped by those early experiences. And so that child who is in that violent experience or has experienced that adversity as a child now is hyper-reactive, hyper-responsive, has decreased coping mechanisms, and finds themselves in a situation where the behavior that we're seeing is really a manifestation of the trauma they've experienced and the way that their brain has been rewired. And if you extend out into communities, it's about, we know that not only does that adversity affect that developing brain, it affects the way genes are coded. And so now we're talking about intergenerational impact of these inequities. We have basically built this system for our children. And now it's time for us to say, okay, little Johnny has a disciplinary problem. Before we expel him, let's do a full health assessment. Let's make sure that he has the capacity to do the things that we're asking him to do. Let's make sure that he's physically healthy and mentally healthy. So thank you for being patient with me and all of my technology issues here. And I'm in the forest, I guess. I don't know how I got in the forest.
But we can see and hear you, so stay there.
It's peaceful.
The background is very soothing. Yeah, I mean, all of the things you've all shared are really, really interesting. And Terri, you brought up another question that was kind of on my list to ask you all about, which is, we're also hearing right now extensively about youth mental health, and COVID has provoked a crisis. School closures, virtual school, and the isolation that has come from that for many children has been incredibly stressful, as well as the traumas associated with COVID infection itself, or deaths in their families associated with COVID. And as the pandemic moves to a different phase, but we are left with all of that trauma, we continue to hear about it. And so I'm really curious to hear your thoughts about youth mental health and well-being and young people's also involvement in the justice and child welfare systems. And Daphne in particular, I'd love to hear from you, just you, someone who had the very difficult job of prosecuting children who committed crimes, often against other children. I mean, what are your thoughts about what needs to be done there?
Well, Jean, it would take a few more hours to tell you everything I think about the problem. But when I went back to public health school, as you said, it was mid-career. I was still a prosecutor at the time, and when I finished, I said to myself, when I go back to, I took a break to do some traditional public health work, and then was invited to come back to a DA's office. And I said that at that point, I would stop. This goes to what the doctor was saying, that I would stop asking, what's wrong with you? And I would start asking, what happened to you? Because, just like, both of the panelists have pointed out, so many young people have experienced trauma. I mean, they've experienced adverse childhood experiences. We know that, there's at least a list of 10 that include incarcerated parents, mothers who've been the victims of domestic violence. It is amazing what I have seen children go through in the years that I practiced. There aren't very many days toward the end, especially, that I walked out with a dry eye. But it shows me that children are amazingly resilient, and that if they have the community support, we talk about the ecological model, the socio-ecological model in public health. And so if there are family members, there's community, but I think the missing piece sometimes is policy, and the political intervention and the intervention of government. I advocated strongly when I was a prosecutor in Alexandria, Louisiana. We were fortunate enough to receive a grant from the MacArthur Foundation, and did some amazing work in that time. But we asked that every young person that came into the system be assessed, and that have a mental health assessment, particularly if they showed signs of mental illness or substance abuse. And that assessment then led to a larger evaluation if there were red flags that were raised. And I think that went a long way to helping us reduce juvenile crime in that jurisdiction for that period of time, because we were able to get a handle on crimes and get a handle on the mental health issue before it got out of control, before the young person started committing more and more delinquent acts. I'll also mention, Jean, that what Dr. says is very true, that in communities that were redlined, there was a significant disinvestment as well. I mean, and that disinvestment continues to this day. And so a young person has to go from, in Shreveport, Moortown, come to a neighborhood called Broadmoor in Shreveport to go to a park that they feel safe in, or that's a nice park where everything works. And so we have to continue, or start at least, putting more into communities that have been disinvested. And I think the other point that I would make is that regarding mental health during the pandemic, I think mental health issues were already a problem with young people from my experiences as a prosecutor. And I knew that this problem was going to explode once we, locked down everybody. And that was confirmed by an episode that I listened to on NPR. I wish I could tell you the number, but if you Google it, NPR in Shreveport, Louisiana, because it referenced the crime in Shreveport. But one of the authors who was on the show talked about how in communities there is this sense of family, and that a young person, a teenager who's 16, who might be involved in some nefarious activity, there were older people in the community who might say, "John, you be good today. You stay out of trouble today, John." But then we took that away. I mean, because we had to, because of the illnesses, because of COVID itself. And so there was then no more support for young people, particularly young people who were involved in the juvenile justice system. And there was nobody to temper the behavior any longer. And I think that's one reason why we've seen such an explosion in gun violence and mental health issues.
So I will say that I have seen some of the saddest young people I've seen in my 25 plus year career. They are dealing with so much. I want to remind everybody that in the U.S., 100,000 children have lost parents. And that's just parents. That's not all the other extended caregivers who are part of their circle, part of their village. So children have experienced a tremendous loss over these last 2.5 years. And as Daphne mentioned, we were in a mental health crisis with a dearth of mental health services for children even before COVID. So that's only been amplified by COVID, and that it's critical that we step up and figure out how to provide those services to young people. That's one of the reasons I think, again, the school-based health platform is so important, because you are there with children in their environment where they're spending the majority of their day. And you can not only assess them as individuals, but within their classrooms and within their school community. But I do want to go back to a point, now that my audio works, to Chris's point about racism and calling that out, because I do believe that it's often the elephant in the room. And, we are all getting better at being able to talk about social determinants of health and inequity, but when we talk about, and bias, but when we talk about racism, people get a little bit squirrely. But we have to really be willing to call that out. And I just want to point out, I like to have a few statistics, but, in the 2015-2016 school year, now this is back to the whole school to prison pipeline, Black high school students were experienced 5 times more days excluded from school than white children. And Black and Hispanic students were much more likely to actually be arrested at school. And my final point, since I took us completely off topic, Jean, but I just wanted to make sure that I underscored in the school to prison pipeline, not only is there an issue around race and the racial disparities, but around children with disabilities who are also really subject to be at increased risk for disciplinary actions and find themselves in the juvenile justice system. Maybe Daphne or Chris has better data, but one study that I saw showed that even though children with disabilities make up 12% of the school population, they represent 37% of students involved in school-related arrests. And there's intersectionality between race and disability as well.
Yeah, and I'm really glad you brought that up, Terry. And one additional comment I wanted to make is we've been talking about communities that have been intentionally redlined, intentionally under-resourced. And if anyone is interested in reading more about that, in some of our prior social determinants of health series, we've talked about this, but also we've talked specifically about a book called The Color of Law that discusses the history of housing discrimination, which has also contributed to significant differences in outcomes by race, particularly when you look at certain geographies. And so, yeah, I mean, to your point, Terry, I mean, when you dig into the data and you even look at data around preschool expulsions, you see that Black children are overrepresented in a way that cannot simply be explained by anything else except disparities in how they're being treated, and perhaps unintentional, but what amounts to racism essentially. And so these are really tough issues, and I want to give Chris a chance to talk, but I think one of my really big questions for you as we get into kind of the last 15 minutes of this is, we've been talking a lot about kind of the fabric of communities coming to some extent unraveled, COVID exacerbating that, the need for new policies and programs or existing things that we know work being expanded. And so I really want to kind of focus on like, so what can we do next? But before we do that, Chris, I want to give you a chance to kind of comment on anything you'd want to share. Terri and Daphne shared.
Well, I have a 6 and 8 year old at home, so I can tell you right now that the trauma that they've experienced, and they have a, and we have a 2-parent family, and they have a lot of love and support. So the trauma that they had coming out of COVID, and that we're still dealing with, the anxiety that we're all dealing with on a regular basis. So what I can say is that what we are seeing globally, and even in our country, is that with regards to COVID, we never shut down. So we shut down for a few weeks, 6 weeks total when it first started. March 15th, we got that call, right? We were on it, and we just started a hub, and so we made sure that we were doing the old door knocks, but also leaving things, trying to be that conduit from society to our young people in the community. And I didn't really see a lot of that happening, broader than our young people's population. So we were able to touch, 300 young people in our community because they're on our list. What I was hoping that we would see more. So I think it's important that when we partner with mental health associations, that we partner with different mental health associations that really are, have brown therapists. It's important that our young people and the people in our community see individuals like them, who model them, so that way they feel safe. The other piece is it's important to recognize that I don't have the data off my head, but I know that I've been in enough Department of Public Health meetings that, marginalized individuals don't get health care in the way that, I can speak from a woman, but I also can speak from what I'm seeing with our young people. Their teeth are rotted. Like, that's on us when our mean for the age is 21 years old. So at 21 years old, their teeth are rotted. And, there's a lot of disparities. But what I can say is that every city's different. Every city has problems, different homicide rates, different gangs, different neighborhoods. But across all the cities that, we work with, that Terri works with, that Daphne works with, traumatized young people really need the same thing. They need a sense of safety. They need a sense of consistency, unconditional love that they never had. They need to know, maybe for the first time in their lives, that there's someone out there that won't give up on them. They need the cognitive behavior skills to cope with their hurt and anger before other positive changes can take place, so they can rewire their brain. And they need to know that institutions interacting with them as traumatized young people, like police, probation, parole, school teachers, and other they're seen as human beings and not the enemy. And people working in these institutions really need to find the hope, and that they know that things can turn around. So, as a privileged person myself, I've had to change a lot of things, a lot of the way I was thinking, because I would do the old, well, I grew up poor, I did this. It doesn't matter. I have privileges that none of these young people and none of my staff have, just because I'm white. And I think more of us white individuals of privilege need to understand that, and do the reading and doing the homework, and take the time, and more importantly, put our arms around any young person who is having a bad day. So I'll end with that.
Thank you, Chris. That's awesome. And I just wanted to also say there's a question that we've gotten that might be a good way to sort of move into more of this conversation about what can we do that works, which is around early education, and specifically asking about how do we connect with early education to build a continuum of coordinated support for children. Terri, I know that this is a part of your work from some of the things you and I have done together in the past, is, really connecting the early education to sort of the rest of childhood. And then Daphne, I'm sure you might have some things to say about sort of what you saw in terms of really young people and their needs. So Terri, would you like to comment on early care and education?
Sure. It's critical that we invest in our children at the earliest ages. And, you know, there's good economic data. James Heckman is a health economist who has created this great grid that shows you how much of a return on investment, if it's all about dollars and cents for you and not even about, you know, these young people who are going to be our doctors, leaders, nurses, lawyers, judges, you know, we're investing in our own futures when we invest in them. But if it's not about the human capital for you, then it should be about the economics. And the more we invest early on, the bigger return on investment we get. We have those that windows of plasticity in that developing human brain. And basically, if we are undergirding those positive experiences for children, then those are the neurons and the neuronal connections that flourish and predict their future. And if we're exposing them to lots of negativity, adversity, trauma, then those are the neuronal connections that flourish and remain, and we end up with what we have. So, you know, it's really important that we think about the quality of the experiences that the littlest people in our lives who have the smallest voice, basically none, they're expecting that we will stand up for them and speak for them. And then we need to be part of the narrative change around, you know, well, you know, using our own privilege that Chris has mentioned. We all have some privilege. Every one of us on this call have some privilege, right? And so using that privilege, whatever it is, to speak for those who don't have that privilege, that's going to be really critical. I guess the last thing I would say about this topic, Jean, is that in pediatrics, we are starting to talk more and more about this two-generation approach, which recognizes that if you're taking care of a child, you really can't take care of them without understanding what's going on with their parents. Because if you want to prevent those ACEs that Daphne mentioned, you've got to make sure that their parents actually have access to mental health and physical health services and have the supports that they need to be able to create that safe, stable, nurturing environment for children so that they can grow and thrive. So it's not just about the child. It has to be about that whole ecosystem that is supporting the child.
I'm muted, sorry. Daphne, thank you, Terri, for that. Daphne, would you like to comment?
Sure. I appreciate Terri for pointing out that that the family should be addressed. That's what I saw so often in juvenile court, is that kids were acting out because of consequences or things that they saw within their home. And so until we recognize that that a kid is acting out because the mother is addicted, and rather than punishing the mother, we provide her with services as well. I mean, that was always the approach and the recommendation that I tried to take in the courtrooms that I worked in. And what makes it so difficult is that, we all have worked in systems. We all know how systems work. It's just, when judges and prosecutors and public defenders walk into a courtroom, they got a stack of cases. And the goal is to move the cases. Let's move these cases and get down, and get the judge out before lunchtime, because that's what the judge wants to do half the time. And so until systems can start adjusting and becoming more nimble to address some of these issues, I think we'll continue to see the same problems in courts. When you talked about, when the doctor mentioned the school to prison pipeline, I mean, what I saw, particularly in the last 4 years in the jurisdiction I worked in, was the referral of children to juvenile court at astronomical numbers. And everything about that goes against what we know from the research and the literature. The closer we bring young people to the juvenile justice system, the more likely they are to repeat delinquent conduct and move further into that system as well as into the adult system. And so schools have to find a new way of dealing with the discipline issues that they encounter. My father taught school for 30 years, and I've asked him before, and I wrote in my book that, I've asked him, can you imagine having an armed guard in the 5th grade class that you work in? And he's like, of course not. I couldn't have even seen that, in the years that I was a teacher. And so we've got to find a new way of dealing with discipline issues in our schools. Police officers are not peacekeepers. They're not mediators. They're not there. They're there to arrest somebody at the end of the day. You say that John's causing a problem, okay, let me remove John from the scene, and that more likely results in an arrest and a referral to juvenile court. It should be that we utilize models of restorative justice that are all over the country, where individuals come in and help and are peacekeepers and mediators, can train teachers to become mediators themselves, to diffuse situations before they escalate, and to keep kids from going to juvenile court. And I'd also like to circle back to what Dr. McFadden said about race and racism. We cannot ignore the effect that it has, of course, in the juvenile justice system, the criminal justice system as well. One of the things that I advocate for in my own book is implicit bias training for individuals who are working in the juvenile justice system. And that's really just scratching the surface of dealing with racism and prejudice, but it's a start. And we're not going to get it done unless it's mandated by government. And so I see Jean giving me the look, so.
We are almost out of time, and so Daphne, those are such great observations, both about restorative justice and the need to address implicit and explicit bias and racism in the court system. We've covered a lot of ground here, and I want to give Chris and Terri, if you have just one last closing sentence, the opportunity to do that before I make some quick announcements. Is there anything else you'd like to add?
Well, I feel like I could go on about restorative justice, plasticity of a mother's brain after giving birth, the whole raise the age, like that. Invite us all back for whatever topics. But it's an honor to be here with these lovely women, and this is a great panel. So thank you so much. And there's just so much. I feel like, please, everybody, go to rocainc.org, because a lot of things that is being said, Roca's doing, and that's it's pretty awesome. So thank you.
And I would just underscore what Chris has said, and just say, stand up for our children. Yes. They really need us to stand up for them and be their voice. And think about trauma-informed care. Think about restorative justice, because we have to change the climate around our children.
Thank you so much, Terri, Chris, and Daphne, for your time today. We're getting a lot of comments of appreciation in the chat for everything that we've covered today. And I did just want to say, we're delighted to have everyone who's online with us today join us. We'll follow up on the questions in the chat we didn't get a chance to answer. And we're really thrilled to have the Social Determinants webinar series return. Please stay tuned for more information about upcoming webinars that'll begin again in early fall. And we look forward to hopefully seeing all of you again, and Daphne, Chris, and Terri, hopefully to seeing you again and working with you in the future. So thank you so much, everyone. It's been wonderful to have you.
Thank you.
Thank you, Jean.
Thanks, Jean.
And my contact information is here on the slide for anyone in the audience who'd like to reach out or has any follow-up questions after the webinar. So thank you.